The questioner asked, why do we need to take vitamins for the rest of our life after gastric bypass surgery? Well, the reason for that is that we want to make sure that we get all of the vitamins we need to run all of our metabolic processes in an optimal fashion. We want our bodies to really work as well as they can. Now, with the type of diet that we get nowadays, we're often lacking in some of the vitamins like vitamin D and iron and some of the carotenes like beta-carotene or lutein. And the vitamins assure us that we're getting the broad panel of vitamins that we need. Now, specifically after gastric bypass surgery, we're not only bypassing the stomach, but we're also bypassing the duodenum. When we bypass the duodenum, we don't get as much absorption of iron, we don't get as much absorption of calcium, and in the process of bypassing the stomach and the duodenum, we don't get as much absorption of B12. Now, let's take iron first. Iron's very important as a cofactor in many metabolic processes. It makes a lot of the energy-generating processes in the body work more efficiently, and it's absolutely essential for the proper building of red blood cells. If a person is low in iron, their red blood cell level is going to go down. They're going to feel weak and washed out, and they won't have the exercise tolerance that they would have otherwise. So after gastric bypass, what we do is we recommend that women who are menstruating take an iron supplement, probably ferrous gluconate or ferrous sulfate, 325 milligrams a day, and then measure their iron levels to see if they're getting enough. For men and for women who aren't menstruating, they're advised to take an iron supplement, but it may not be as critical. So again, it's better to start off taking the iron supplement and then have the iron levels checked, and if the iron levels are going a little high, cut back on the supplement. Turning to B12. B12 is another vitamin that's important for the proper production of red blood cells. If you don't get enough B12, your red blood cells end up being too large, and there aren't enough of them. And so once again, a person will feel weak or winded if they have a B12 deficiency. In order to supplement the B12, we use a sublingual tablet. It's a little tablet that dissolves under the tongue. The problem is that if one just took a B12 pill or took B12 complex, the pill would pass through the stomach into the intestine, and the B12 might not get absorbed into the body. But by taking the B12 under your tongue, the B12 goes right into the bloodstream and it goes right to work. So we recommend that folks take B12, 1,000 micrograms a week with a sublingual pill. Sublingual means under the tongue. There are some other approaches. There are some intranasal B12 preparations. There's B12 gel, but I think the B12 pill that goes under the tongue is the least expensive and easiest way to do it. Now, taking a look at some of the other vitamins, we've talked about iron, we've talked about B12, we talk about calcium. Calcium is also largely absorbed in the duodenum. The jejunum can absorb calcium also, but with a gastric bypass, one is bypassing the duodenum, so there's less calcium absorption. So we recommend that both men and women take a calcium replacement. Citracal or calcium citrate is probably best absorbed. So we'll generally recommend calcium citrate in the form of Citracal, 1,200 to 1,600 milligrams a day. And the calcium citrate often comes mixed with vitamin D, so that would be 400 to 800 international units of vitamin D along with the calcium citrate. In order to measure, to find out if you're getting enough calcium in your bloodstream, it doesn't work to simply measure the calcium level, because your body protects your calcium level by absorbing calcium out of your bones if you're not getting enough. So when you measure the calcium levels, they'll generally be normal whether or not you're taking enough. So what you need to do in order to check your calcium metabolism is look for indirect measures of your calcium metabolism. So say for instance you're not getting enough calcium, your calcium tends to go down a little bit, then glands in your neck called parathyroid glands secrete more parathyroid hormone, which tells your body to absorb more calcium. And so if you do a measurement of your parathyroid hormone level and it's up, you can tell that you're not getting quite enough calcium. Another way of measuring it is to look at your alkaline phosphatase level, specifically your bone alkaline phosphatase. If you're not getting enough calcium, your body's going to get calcium out of your bones, and your bone alkaline phosphatase level is going to go up. So you could look at your serum parathyroid hormone level. You could look at your alkaline phosphatase level. If those levels are going up, then you may not be getting enough calcium. Let's take a look at vitamin D. Vitamin D is important again for bone metabolism. We don't get very much vitamin D in our diet. Vitamin D comes from fish oils, it comes from egg yolks, and it also comes from dietary supplements. But unless one is eating a lot of fish, one generally doesn't get enough vitamin D in the absence of supplementation. So we will generally suggest that people take vitamin D either 400 or 800 units a day, depending on their needs.